everyone. Namaste. Thank you for being here. I'm Dr. Ruhi, and I welcome all of you to our IAFM Spotlight series. It's an exclusive series where we invite our IFM, one of our IFM members on every episode. And the idea is to learn more how these functional medicine practitioners make a difference in their patients' lives. Each practitioner has a different way of dealing with their clients, and it's wonderful to know what is different that they are doing. So thank you all of you for joining. And today we have Dr. Visalam. Dr. Visalam, a very warm welcome to you.
Thank you so much, Ruhi. Thank you very much.
Thank you. So she's a medical physiologist, and post that she went ahead and trained herself in functional medicine. And she did not stop there. So to really help her patients, with a complete holistic approach, she went on to train herself in Ayurveda. So she went ahead and trained herself in Ayurveda, mind and body healing, yoga, medical cannabis, and you name it. So it's wonderful to know, Dr. Visalam, that you've gained experience in all these different fields, to really combine and deliver the best.
And thank you, my pleasure. Thank you so much.
You have great experience in using medical cannabis in your patients, and you've seen amazing outcomes in them. And that's what we want to know from you today: how you use it, and how are you making a difference. So, but before that, I would love to know, why did you really get started, or in this field of functional medicine? You left the conventional stream and you joined the functional medicine. So what was the decision? Why was the decision?
Like 90% of functional medicine practitioners, I'm no different. I got sick, and I was sick since my age of 13, which the medical fraternity could not find why I'm getting those symptoms. All that they could say is it's in my mind, it's in my brain, it's something psychiatric, while I was still a good student in school or college. Then went to MBBS. There again, the topmost doctors could not identify why I'm having it. And then later, while I was doing MD final year, I said, enough is enough. I'm getting some investigations done. And I got some investigations done. And then those investigations came positive. And then took those investigations to all the people who said there's nothing wrong with you in the body. And they said, yes, you have this. And mine was a very non-classical case, right? Mine is a very less percentage of multiple sclerosis patient have radiologically isolated multiple sclerosis with sensory symptoms. So even the neurologists who treat multiple sclerosis day in and day out, this kind of a variant is very, very difficult for them to see it at first. So, you get football here and there. Then finally, then I got the diagnosis, and that's when I heard about functional medicine. Just read few books, inculcated those habits in my life, and it showed major difference. Imagine, Ruhi, if I've had the symptoms since my age of 11 or 12, and starting functional medicine protocols at that point in time, we didn't even have this many supplements or this many things. In fact, like you said, CBD was not even available, easily available in India. It was not even legal. It was not even easily available in India. With whatever I read, with whatever I could practice, within 3 months, my floaters went away. Within 6 months, I took my MD final exam. Within 9 months, I was running a marathon. When I took the scan myself, I was almost bedridden. I could not walk, not because I had any paraplegia or I had any paralysis, but because my muscles were atrophying and I had no energy. And the brain fog was very severe. Depression was very severe. So at that point, so in 9 months' time, I was running a 10-kilometer marathon. I won't promise, I won't tell you whether I completed it or not, but I was still running the marathon.
That's amazing.
That is, so that is why functional medicine, like I tell all my patients, it's the purpose, it's the passion. Only after I got diagnosed with one such thing, then then I got to know about functional medicine. So it gave me the purpose of my life. At a very, I mean, when you get sick, you also get very spiritual, right? So it gave me the purpose of my life.
And you
So
didn't want
that's
to
why functional medicine.
yourself, and you really wanted to, give it back, to the society, and, to all those people who could really benefit from that knowledge, that experience that you gained during your own journey.
Correct. If I could regrow my own brain, then we can do so many other things with just food and lifestyle. You don't have to inject people with multiple various different things, right?
Absolutely. Absolutely. So, Dr. Visalam, you're a warrior, and we would love to know what is that, how are you really making a difference in your patient's life? What is that you're doing different?
What is that I do different is I'm not see I won't say I'm doing it different because I do not know what lot many other people are doing, right? But I can tell you there are few things which I say, okay, I'm doing this which is different from conventional practitioners for sure.
Mhm.
I start all my consultations with the mantra, and I end it with a mantra as well. That is one thing that patients have told me, oh, no other doctor does it. So I think that is different. And because I'm also trained in yoga therapy, I give them pranayama, I give them asanas to do. And then give them actually a lot of food to eat. When they come to me, when patients come to me, they'll be like, doctor, is the diet going to be very strict? Do I have to fast a lot? So give them a lot of food to eat to begin with. Then I don't
Mhm.
give them recipes or cuisines. I tell
Mhm.
them, this is what I want in your plate. Cook as you like, cook
Yes.
as you can eat, because it's food. We get bored very quickly if we eat the same kind of food.
Mhm.
So I don't give them
Give them,
recipes,
give
or
them
I
the
don't tell them.
ingredients, give them the ingredients and let them play with it.
Correct. If you say say this much rice, this kind of vegetables, this, make sambar, make salad. I don't mind, but this has to get inside. And there's no specific diet. That is something I think we all tell our patients. It's not keto, it's not pagan, it's not vegan, it's not vegetarian, it's not dash, it's nothing. It is that person's diet. If I'm the patient, then it's a diet that will suit Visalam. If you are the patient, then it's a Ruhi diet. It's very customized to each one of them depending upon their lifestyle. So I
Mhm.
think that is the difference. Of course, CBD is a major difference.
Mhm.
To a level, in the beginning, I had to convince them to actually have it. Then later, patients start coming saying, "Oh, you do CBD, doctor, so we will take your holistic treatment." So CBD is a major difference.
Yes, and there is still, not enough awareness about CBD. Some people still associate with a certain stigma around it, and that's because of a lack of knowledge, right, about CBD, the potential it has, the medical therapeutic value it can offer. Yes.
See, if you tell me that not many people know about CBD, then it's a no, because everybody knows about it. The minute you tell them ganja, marijuana, cannabis, most of them know, including the most conservative
Hmm.
housewives or even a rural. They all know about it. But only thing is, what they think about is that it's very illegal. They will go to jail, and they will get addicted to it, and the society will talk bad about them if they eat it. So that's what they think. But if you tell them it will come with the prescription, I'm the one who's prescribing, you won't go to jail. Before you, I will be the one who will go to jail if it's not legal enough.
Mhm.
So you have to convince them and tell them, I give it for patients from the age of 1.5 until the age of 80, 85. Right?
Mhm.
Everybody can take it. And I have given a patient of 1.5, 2 years, 3 years. Children come of every age, right? So I have
Yes.
given and they've all benefited. So when you give them that kind of a trust, then they're willing to try. Once they try it, then they will be like, no, doctor, it is making a difference. Then, but the later at a later stage, they're like, doctor, it's making a lot of difference. I'm really liking it. Will I get addicted? Is a question that you get heard at the end of the package. Then
Yeah.
they're like, you want to stop tomorrow? You can stop tomorrow. It's okay. Medical cannabis, especially with the ratio that you give, it's not addicting at all.
Okay. Yeah. So, Dr. Visalam, we would love to know more. So, I hand it over to you. Please go ahead.
Thank you. Thank you. Let me share the screen, give you some science about CBD, and
Yes.
then we'll get into any other questions that you have. All right. So you guys can see my screen?
Yes. Yeah.
All right. So to begin with, today we'll be talking about CBD, but first we'll
Sorry
figure
to
out
interrupt,
how this.
doctor. Do
I'll
you?
put in the slideshow. Yes.
Yes. Yeah.
Yeah. Yes, Ruki, I could hear you. All right. So
Thank you.
first, let's start with endocannabinoid system, right? It is a system that has receptors all over the body, which mostly controls your central and peripheral nervous system. ECS, that is your endocannabinoid system, will only come into action if there is a homeostasis derangement. Otherwise, it does not come into play, which is why we also call it demand feedback system. Endocannabinoid system is one such thing. If your body is not in homeostasis, that is when it will come into play. Our own body secretes endocannabis, and they are called AEA, anandamide, or 2AG, arachidinol glycerol, however you want to pronounce it, right? Our own body produces two endocannabis, right? The CBD and the THC that we're going to talk about is external cannabis, but your own body has its own endocannabis, which is what will come into play if you have a homeostasis derangement. Now coming to Vijaya. Vijaya is the actual Ayurvedic herb or herb as such. Vijaya, it's named Vijaya because whatever you use it for, success is the end result. That's why it was named Vijaya by our ancestors some thousands of years ago. It is one of the king herb in Ayurveda. So Vijaya has been used in India or even in Asia, even in many parts of the country, including South America or Africa, for a very, very, very long time. But it was criminalized for reasons that we all know for, which is not a part of this discussion. But now it's back again, and it is a pure herb which actually grows in your backyard in your tropical countries. I have read where people actually take the leaves and chew and get better. Or cows will actually eat them. Cows do actually eat the plant, and when it secretes milk, it has its anti-inflammatory property, and people will use it for their medication. When we call vaidyas, those palace vaidyas and all those medical practitioners those days, they used to use it. How does it work? Now coming to the science part of it, there are two receptors, CB1 receptor and CB2 receptor. They are spread across your body. There is no one place in your body where these receptors are not there. Brain has the maximum concentration of CB2 receptors. Your immune system has the maximum concentration of CB2 receptors. Your spleen, pancreas, liver, gut, all of them have CB1 receptors. More science into the receptors. It is a G protein coupled cannabinoid receptor. It does mediate your physical and psychoactive effects of cannabinoids. CB2 receptor is the one that regulates your inflammation, works in all your organs. So you want an ingredient that will react with CB2 receptors for your autoimmune conditions. Coming to CBG. CBG is it's one of the 114 identified cannabinoids. It is a minor constitution. There are in your cannabis by itself, you have CBD, you have THC, you have CBG, you have about 114 to 85 chemical components, among which CBG is one, and it's a very, very small part of that. Hemp seed. So usually what we use to extract CBD are the leaves and the flowers, not the seeds. Seeds do not have any of your cannabis. But hemp seed powder or the leaf powder has absolutely great anti-inflammatory nutrients. Like it has all your essential proteins, it has omegas. So they all work wonders, and you can make CBD oil, which is great for hair growth and skin, which is what is booming up in the cosmetic industry today. Demand feedback system. Like I told you, if you give cannabis, if there is no demand in your system, then there is no production of any neurotransmitters, or there is no protein metabolism happening there. There is no phosphorylation happening. It will only happen in the space of feedback system if there is a demand. It is a demand-based system. The terpenes and flavonoids come along with your CBD, because all your plants have terpenes and flavonoids. One special flavonoid here is the canoflavin, right? That has big anti-inflammatory effects, like your green tea flavonoids. Coming to the major one that we all know, CBD. It is one of the medical compounds of your cannabis. So cannabis, endocannabinoid system is different. CBD is cannabidiol, right? So that is one of the chemical component of cannabis. There are about 114, some say 85, some say 156. The number is still not clear, but at least we definitely have 120 compounds. In that 120 compounds, CBD is one major compound. That is cannabinoid, however you want to produce it. THC, right? THC is tetrahydrocannabinol. It's also called Delta 9. If you go to the US, if you go to North America, if you go to Africa, they all call it Delta 9. In India, we still call it THC. So THC is also a major chemical component among those 114 chemicals. This is the only one that causes psychoactive effect. THC is also very, very useful. THC is not to be omitted. It's very, very useful. CBN is the mother chemical. From CBN is where we get CBG, CBD, THC, CBA. There are so many other components there, but CBN is the mother component. So first we have cannabinoid, which is the actual extract from the cannabis, right? Then we have cannabidiol, that is the CBD that we locally call now. Then it's the THC, which is the psychoactive part. CBN, CBG, they're all one of the chemical components of cannabinoid. And powder, like I told you, the plant and the seeds, they make powder out of it. The leaves and the seeds, mostly the seeds, they make powder out of it, which has all your essential amino acids. In fact, if I get a vegan patient for their protein supplement, if they're already not taking any, I give them hemp, which will give them all the essential amino acids, branch chain amino acids, everything. Plus, it'll also give you some fiber. It'll also give you some chlorophyll. So I really like hemp protein powder. Like I told you, there is no part in that entire system where your CB1 and CB2 receptors are not present. CB2 receptors are concentrated in certain parts, but they're all present everywhere. Name it, nerves, organs, name it, everywhere. In every cell membrane, they are there. In fact, we still do not have an exact count of how many receptors we have, where is it highly concentrated. So please understand that cannabis now, according to Ayurveda, it's old, but according to our modern science, it is still being researched. It's still being researched. So coming back to your feedback system, that is something that I want to tell you is when, which is also why in medical cannabis, you do not get addicted to it, because it's a feedback system. Because it's a feedback system, people also get resistant to CBD and THC quite fast. Now, going back to your receptors, which works in which receptors? CB1 receptors are for your CBD. CB2 receptors, which is present everywhere in high concentrations, are for your THC. THC is what you require to bring down your autoimmunity or you bring down your inflammation. But THC is also psychoactive, which is why you need to dose it in a certain level so that they do not become high but you have the effect. It is an immune modulator. THC is actually an immune modulator, which is why it works wonders in all autoimmune conditions. It works wonders for all your cancer patients also, because the better the immunity, your immunity will kill the cancer cell. That's why it works in your cancer cell as well. Coming to a little more detailed science about this, THC is an antagonist of CBD. That is, THC blocks all your receptors. So if you give high THC concentrated version, your CBD action will be very minimal because it's an antagonist. If you give CBD only without THC, then it will saturate all your receptors and you will get an action. So it is an antagonist. It is a competitive antagonist. In fact, THC works in both your CB1 and CB2 receptors. CBD is still not very clear where it exactly works, but what they say is CBD actually blocks the breakdown of your THC. So it's always better to give CBD and THC in concentration, in combination, other than contraindicated conditions. Because if you give CBD, your THC's action will be stronger and longer. So that is some amount of science, but of course, we all need some more research on the science. Coming to the medical benefits. In fact, one slide or one session is not enough to tell you the medical benefits, because you name it, it will benefit you. Low appetite, it will benefit you. No sleep, insomnia, yes. Pain, yes. Anxiety, yes. Depression, yes. Any autoimmunity, all your autoimmune conditions, it will help. Cancer. Nowadays, people are looking into cannabis because it's working wonders in cancer. In fact, the pharmaceutical industry by itself is coming in to make this a phytopharma product because it works wonders in cancer. Pain, chemotherapy, give your chemotherapy, give your immunotherapy, whatever you want. It will help you elevate the side effects, pain, nausea, vomiting, diarrhea, constipation, your gut issues. It will work wonders on everything. Neurodegenerative conditions is another set, right? Alzheimer's, Parkinson's, multiple sclerosis, neuropathic pain, autism. When I actually entered CBD, I did not prescribe CBD or THC for patients at all. Then one of the patients called me and said, Doctor, I know that in the US, the doctor gave CBD for an autistic children. So can you prescribe? That is when I started prescribing CBD for autistic children. And the feedback that I got from that those kind of patients are simply satisfying, because they say my child was self-harming, now my child has calmed down. My child had no attention, now my child has a longer attention span. My child never volunteered to talk, but now my children are volunteering to talk. Another one that CBD and THC works wonders are seizures. Like I told you, the 1.5-year-old child was seizing very severely from the time the child wakes up. So I put the child on pure CBD isolate, and the child's seizure reduces. I mean, we all know that the seizure reduces, then the development increases in a child. The seizure reduced. I won't say it went to zero, but if the child was seizing as soon as she woke up, and until the time, it definitely reduced 50-60%. I mean, of course, with 1.5-year-old child, you can't increase the strength and give. So some amount of seizure is still there, but at least it reduced. So seizures, adult seizures, it works. Juvenile seizures, it works. When it comes to pain, all forms of pain, acute, chronic, surgical pain, including dental pain, it works. It works to a level where you do not have to keep them on any painkillers. You can reduce all their painkillers. In fact, I tell them, take CBD, stop your painkiller. This will work wonders. Then once we identify the cause for your pain, once we treat the cause for your pain, in fact, CBD will also help treat the cause for the pain. then you can also reduce CBD if you require. But according to me, if it's one of the king herbs of Ayurveda and it can be used for wellness, it definitely can be used for wellness, like how we all do wellness, maybe some fasting and some, chelation or something. This herb can be there in minimal quantity just for a wellness. And it's also anti-aging, eh? So it works anti-aging. Insomnia. How many of our patients sleep well? So many reasons for them to not sleep well. Stress is another one, right? Insomnia. In fact, I've had an atopic dermatitis child, very severe atopic dermatitis child, about 6 years old, who never sleeps because atopic dermatitis was very, very itching, severely itching, and the child never went to sleep. It hardly sleeps about an hour or two. From the day that we started CBD, only for sleep, not for atopic dermatitis, only for sleep, I told them it's very severe atopic dermatitis. I won't be able to help you there, but sleep, I can put your child to sleep. We started CBD. It took a few days for the child to get used to. Then the child started sleeping 6 hours straight. It works on children. It works on adults, especially Alzheimer's patient, Parkinson's patient, senile patient, geriatric patients who struggle to sleep. Insomnia, I mean, pain and insomnia are like guaranteed result, right? Guaranteed result. Autoimmunity, cancer, they're all next stage of results. But pain and insomnia as symptoms, I have got guaranteed results. I've never had any patient come back to me and say, oh, no, doctor, I'm still in pain. No, doctor, I'm still not sleeping. So that is one guaranteed result that I've got. Anxiety and depression. For anxiety, they become much more calmer. Their palpitations come down, they sweat less, they're much more calmer. So anxiety, it works. Depression is, how does it work in both anxiety and depression is a question that I had when I first started studying CBD. But then later, like I told you, it works on demand feedback system. If your endocannabinoid system is activated to produce serotonin and dopamine, it will start producing serotonin and dopamine to help with your depression. But if it has to stop the signaling of overproduction of neurotransmitters in case of anxiety, it will also stop the production of neurotransmitters in case of anxiety, which is why cannabis plays a special role because it's demand feedback system. Autoimmune conditions, the kind of autoimmune conditions that I've got good results with is autoimmune conditions that's related with pain. Osteoarthritis, rheumatoid arthritis, systemic lupus erythematosus, because they all come with pain. It helps. Hashimoto's is something that's helped me as well. But of course, LDN helps more in Hashimoto's than CBD. We will come to that at a later stage. Psoriasis, both application and intake. Eczema, atopic dermatitis, seborrheic dermatitis, all autoimmune conditions, multiple sclerosis, they all work. Delayed sleep syndrome, they all work. Cancer, one of my mentor, Dr. Tahir, he's got great results with breast cancer, rectal cancer. So a lot of women-oriented cancer, brain tumor. Brain tumor is schwannoma is something that works wonders with CBD. So brain tumors, your breast cancers, rectal cancers, your stomach cancers, oral cancers, they all show great benefit with CBD. Autism, like I told you, neurodegenerative conditions. I'm an example myself. Alzheimer's patient. Recently, I started consulting an Alzheimer patient. So the first consultation that I had with her, she was talking nonstop. She didn't remember her husband or her children. She wasn't able to make eye contact. In fact, her husband told me that when you take a glass of water, she will not know what she has to do with it. She'll just keep staring at the glass of water. If she says I have to go to the bathroom, but she'll just sit. She won't know that she needs to get up to go to the bathroom. 2 months from the treatment, of course, along with CBD, there's a lot of other supplements that we gave as well. But 2 months into the treatment, and then now she's giving us eye contact for a few minutes. She's not talking nonstop. Of course, she still does not remember her husband or her children. But the husband says, if I'm taking cut fruits or cut vegetables or one glass of water and take to her, she knows she needs to eat and she starts eating herself. So that by itself is a great improvement in terms of the husband, for her husband, because now he does not need to feed her. She eats herself. So I know, and Parkinson's tremors comes down drastically. So neurodegenerative conditions, it works wonders, but you need to give a high THC. We'll come to the dosing in our next slide. Coming to market of cannabis, of course, there's an illegal market. There has always been an illegal market from the time it was criminalized, not criminalized Ayurveda. There's always been the illegal market. We do not know anything about it, where it comes from, how they extract it, how to consume it. We do not know anything about it. Of course, one thing that we know is smoke. You can smoke it is something that we all know because we read about it. Otherwise, how they extract it, we do not know. Coming to legal market, yes, it's very much legalized in India under the Ayush Ministry. There are about 2 states in the country which can grow it, and there are manufacturers who can manufacture it. And of course, you can white label it however you want it and whichever concentration you want. It's very, very legal. It is legal with prescription. Doctors, if they prescribe it to you, it's very legal. You can show it to them, and people are not inquired on this one. The market is very, very safe today. Now, in the legal market, what all you get? You get oil. Like I told you, you get whole plant extract. You get concentrated versions. You get it in oil. The extract is mixed with a carrier oil, mostly coconut oil or MCT oil. You can add any other essential oil to it. I've had people mix peppermint oil, frankincense oil, turmeric. They add so many other different things to make it more palatable. If you ask me whether it's not palatable, it's very palatable. Of course, I've tasted it. It has a very herbal taste to it. It's not bitter. It's very palatable. Today, you get it in multiple different flavors as well. But oil is the constant, and oil is the most legalized form all over the world. You have paste. When you get a paste, it's a much more concentrated which means there is no carrier oil to it. It's the raw extract of it. It's either the raw or the dewaxed extract of it. There is no carrier oil mixed to it, so it's not diluted. Paste always is in a concentrated form. It will come to you in a syringe. Then you have gummies. Gummies work wonders for me in terms of anxiety, restlessness, nervousness, or children as well, because gummies is just like your toffee. You have to take it. Comes only with CBD. Gummies do not have THC in it, at least here in India. So you just have to take it, and gummies taste very nice is what I've heard. So gummies work because if somebody is anxious or they're going to give a presentation and they want to calm themselves, gummies work wonders. And also, I forgot to put it in, the benefit of it, it increases your memory, it increases your concentration, it increases your energy levels also. So chronic fatigue syndrome, CBD works wonders. Food. Today you get hemp or CBD in some forms of food. Like they kind of diffuse it into your honey. You have those laddus, which they make it with hemp seeds and some concentrates of CBD as well. Then you have modaks. So some form of food is also available. Dubas. So when you say dubas are those smoke, right? Only one company in India gives legalized cigarettes and dubas. Why is this required? Why can't we just deal with oil and paste? But dubas, or when you smoke it, is when your bioavailability is 35%. When it's oil or paste or sublingual or whatever you take, it comes down drastically to 25%. If it's ingestion, then it's only 10%. Or 5%. But smoking is where you have the maximum bioavailability, which is why now in our country, we're trying to make it legal, because it's much easier for a lot many more patients, especially very sick patients who cannot take it sublingually or who's not able to take it orally. Dubas work wonders. Capsules, of course, there are capsules that also work, but the moment you ingest it, your bioavailability becomes lesser, but it still works. It still works. Balms are for applications mostly given for skin issues, especially psoriasis, eczema, or pain. Menstrual pain, joint pain, chronic pain, neuropathic pain, migraine, headache, spondylosis pain. It works wonders. And all of these are varieties of the forms that are available. How to pick the right CBD dose? So, first of all, you need to assess what the patient requires, whether it's a CBD isolate, whether it is a CBD only, whether it's CBD THC, whether it's CBD dominant, or whether it's THC dominant, or whether it's CBD THC balanced version. So you need to figure out which one you want, whether it's a whole plant extract, whether it's a dewaxed extract, do you want it in paste, do you want it in syringe, and all of that. To calculate CBD according to your weight, according to your severity, according to your disease, there are online calculators, which is more or less quite good. But when it comes to THC, there are no calculators. Always start small. I always start all my patients with 2 drops. Even if they say, doctor, I have severe pain, you cannot start them off with 10, 15 drops, right? You always start them small, then you increase it. Once you've increased it, they have to slowly increase. When they're comfortable, you stop them at that. You still don't take them to a maximum because, like I told you, there are good possibilities that they will become resistant. So you keep them at a very comfortable dose. And then if they become resistant to that dose, then you can increase it. And dose, when I say dose, it also means the number of drops that you give them. That is also dosage. When you reach the maximum number of drops, then you increase your strength. You get various different strengths, starting from 100 to not 100, 1,000 to 2,500, 4,000, 5,000, 6,000 strength you get. So when you say strength, it's about that 6,000 mg, right? Available in how many ml of the given container. That's where your strength lies. If you have 6,000 mg in 30 ml, it's still low concentration. Whereas if you have 6,000 mg in 10 ml syringe, it's high concentration. So you need to decide your concentration depending upon the case that you're dealing with. Also, for neurodegenerative conditions, THC dominant works because it has maximum receptors in your nerves, etc. So THC dominant works. When it comes to children, or when it comes to people who do not want THC, there are patients who read up comments say, I don't want THC. So all of them, you can give them CBD isolate, or you can give them just CBD, which will come with CBD, CBN, and all of your other terpenes and flavonoids as well. Like I told you, different ratios, different strength. In fact, every day, each company is coming up with different strength. In fact, when I started up, it was quite simple. But then now there are newer strength, newer concentrations, newer 5 ml, 10 ml, 20, 30 ml. I don't think we have anything more than 30 ml, because if you give them in large, legally, you might think that they will have it for a longer period of time and can get addicted. So there's nothing more than 30 ml, at least as of yet, in the market today. But there are different strength. In fact, recently I saw 3,500 strength as well. I've never used it, but there are different strengths, different ratios that's coming by, which is why I've just put it as different ratios and different strengths, because tomorrow if you wake up, there'll be a different strength and a different combination. It just depends upon the manufacturer, right? What you want, depending upon the weight of the patient, depending upon the severity of the patient, depending upon their past experience. People who've been alcoholic or people who've had weed before, you can start them on a slightly higher dose. But people who are nascent, then you have to start them very slow. Another added benefit of CBD, on the contrary to what people think today, that it is very addicting, it will actually help with smoking and alcohol addiction, because it fights for the receptors. They're different receptors. It fights for the receptors, a different receptor system gets activated, and it's used in de-addiction of both alcohol and smoking. I've had great benefits for patients who come for smoking de-addiction. We all want, in fact, I'm an optimist at all angles. So for me, everything is good. So CBD for me is 99% good. But for presentation's sake, I need to give you if there are any side effects of the CBD, right? Of course, if you are new to it, if you take a dose higher, then the effect is effect of getting high. Yes, you will get high, but it's very short-lived. In fact, I've had patients um, who got very high because they took it in a time that was not prescribed to them. They took it in a dosage that's not prescribed to them, and they got high, and they didn't know what was happening to them, like palpitations or sweating, or they were blabbering, and the mother didn't understand what was happening. The wife didn't understand what was happening. They thought, oh, they're going into a stroke, and they actually took them to emergency and then gave them fluids. Of course, the emergency doctor was not able to find out what was wrong. Because all your parameters would still be normal, but you will still be blabbering and things like that. Then when they ask what all did you eat in the day, then they will know, okay, you just got high, relax, I'll give you more fluids and you can go back home. Yes, there are possibilities of getting high if you give them a variant with THC. With CBD, you cannot get high because there are no mental psychoactive results with it at all. All the effects of getting high will be there, like dry mouth, drowsiness, dizziness, hallucination. You will start blabbering. You will feel like you're flying. You will feel like it's not real. You will see things that are not real. So yes, and there are patients who came back and said, doctor, it actually felt good. So then you cannot keep doing that, right? So those are your side effects. When you keep them on CBD per se, there's no addiction to it. Even if you give them medically calibrated THC, which has a certain amount given at a certain time, then yes, THC is also not addicting. In fact, when I went to North to get my wisdom tooth removed with a holistic dentist, along with, of course, he does not give you painkillers because they're holistic dentist. He put me on some homeopathic drugs, but beyond that, I still had pain. And I took 1:1 high concentration of CBD for the pain, inflammation. I also had some amount of fever for all of that. And my healing was much rapid. Your pain goes away in few minutes, right? Your pain goes away. Sleep was good. So I took it he removed 3 tooth of mine, 2 tooth at one sitting and 1 tooth another sitting. So I've maximum together taken CBD for 4 days, not even 4 days, 4 nights, and there is no addiction. You do not want to go back to it. You don't crave for it. It's not about willpower at all. There is just no craving to it. The higher concentration also has a bitter taste to it. So, and it also stays in your mouth for quite some time. So you don't want to taste that. Now, coming back to one part that I want to tell you is sublingually, right? Like I told you, oil is taken, both oil and paste. They both are taken sublingually. Sublingual has better absorption, like we all know. There are also rectal suppositories. Rectal suppository also has the maximum absorption, which does not have to go through your digestive tract or anything, directly blood absorption. So, which is why sublingual works really well for autoimmune and cancer conditions. Rectal also works wonders for sublingual and cancer conditions. What rectal is very, very rare, but what is commonly given, both the oil and paste are sublingual. You can, because paste is very sticky, you can either take it sublingually or you can do it in your upper palate. But in my experience, they're all very sticky, especially paste is very sticky. So even if you take it in your finger and put it, it sticks to your finger. It's very, very sticky. Oil is much better because you can still drop it. Oil for count is also much better. So both oil and paste is sublingual administration. These are the effects. Thank you so much for all of your interest in CBD, because I've had vendors, I've had manufacturers come and tell me, I've even had naturopathy, Ayurvedic doctors come and tell me that if you take CBD to allopathic doctors, they will immediately close the file and send it, say, this is not our expertise, this is not allowed in India. If you take this, don't come back to us. So, not many people are open today. But as we functional medicine practitioners, we being open to all forms, all fraternities of medicine, CBD will be a good addition to your practice. In fact, I know doctors who per se only do CBD in the US. They only do CBD. They do CBD, treat the patients and go back. They don't do anything else. No supplements, no diet, nothing. So per se, CBD can be a single mode of treatment also, but otherwise, it's a great addition once you learn more about it. Once you can convince your patient. Of course, there will be some amount of resistance, but it's time that we all grow. CBD has a huge future. There is so much demand today. It has a huge future. So both functional medicine and CBD will go hand in hand because there's so much demand today and there's a great future. Thank you so much for this opportunity, the entire Indian Association of Functional Medicine and all my fellow doctors. And thank you, Ruhi, for hosting this. I'm going to stop sharing so that we can go into Q&A if anybody has any questions, or if you have any questions, we can go ahead, Ruhi.
There are a lot of questions. So, Dr. Visalam, first of all, thank you for this informative session. I don't use CBD in my practice, so it's amazing to know that what kind of difference we can really create in the impact that we are trying to make. And that's the beauty of functional medicine, that we can use diverse tools and based on what really is needed for the clients we deal with. So I have
Yes.
one question. So how do you decide how long it has to be taken? Of course, you said that the body gets resistant to it, but then still, how do you decide? Is it a week? Is it a month? Is it longer? How do you decide?
No, actually, CBD is a journey. So when I get patients, I'll tell them, in my experience, with my knowledge, this is what I think will suit you. But this may not be your final dose, right? The dose will keep changing and the time will also keep changing. But I do not set any time saying you have to take it for this many months. The patient will desire, like we all know, right? Like the patient will desire, I want to only take it for this many months. I'm feeling better now, let me stop it. But if given a choice, like my parents today take 2-3 drops every day, right? So if given a choice, I will have everybody take it 2-3 drops every day, as at least CBD, if not THC, at least CBD for wellness per se, because it's very anti-inflammatory. So if you ask me, my personal recommendation would be through and through. But like how we say vitamin D, right? Through and through. But
Hmm.
at least you should keep them for 6 months to 1 year for them
Okay.
to see great change, for them to even cure out of the disease that they want to cure.
So I have a question here. So let's say if you're giving it to, let's say for any autoimmune condition, so then also again, you just take it for a period of 6 months or a year. It's not required that the person takes it for a lifetime.
It's not required. But of
Okay.
course, of course, like when the autoimmune patient comes to us, we will also would have dealt with the cause. We would have taken their gut into consideration, healed the basic cause of it, and they won't require. Like I told you, your body produces endocannabis by itself, so you won't need to substitute it for a very long period of time.
Right. Yeah. So there are a couple of questions regarding autism. So how, like you already explained, how it can help with the hyperactivity, with this, with the self-harming activities. So is there something more you want to add? How CBD is helpful for autism?
So with for autistic kids or children, I start them on a CBD isolate unless they are autism with seizures. If they are with autism and seizures, and if they're slightly older children, then I give them a small dose of THC, because for seizures, you need THC. Otherwise, I make sure that the child is on CBD isolate only. And with CBD, I give them 3 times a day, and it's sublingual. Sometimes I give them gummies also. And the results with autism, like I said, whether it's been beneficial or not, it's been very satisfying as a doctor, because I don't do pediatrics. I tell them openly saying, I don't do pediatrics. It's not my expertise. But for autistic children, I give them CBD, and when they come back and say, "No, doctor, they are improving. Their attention span is improving. Now they're able to make sentences. Their vocalization is improved. Their vocabulary is improved. Their self-harm has decreased. They don't cry anymore. Their trigger with the noise or smell also comes down. They sleep better. They sleep better. So those are things that those are benefits that I've gotten from autistic parents.
Wonderful.
And of course, the stress levels of autistic parents also come down, right? So that's an added advantage.
Yes, yeah, yeah. So,
Dr.
Muni's
Ruhi,
asked, yes.
sorry we have joined little late. I know there was two different links which we had earlier. So we joined in a different link and we missed the complete conversation which has been done over here. And we were more interested in this what you call this meeting. Now I know it's already been done. So can we have the questions, or it is already, it is something is still pending, or we can ask the questions?
So we'll take up your questions. Who is it? Yeah, so we'll take up your questions. We have you'll have the session recording also available. I'll take up your question as well. I have a couple of questions in the chat box, and then I'll take up your question.
Okay, please do.
Yeah, okay. So, Dr. Visalam, for children with autism, so Minnie is saying she has seen negative impacts also at times. So, what readiness does body require for CBD to work and help?
See, with like I told you, right? I mean, it's not like I've not gotten negative with CBD. I've had parents come back and say, "No, doctor, after giving CBD, he seems to be more restless. He seems to be more hyperactive. What to do?" But that is when you realize that the dosage that you've given them, in the concentration that you've given them, is not the right one. So you change that and you go back to it, then it's always worked, right? Like CBD is still under research, and CBD for autism is very much under research, because autism by itself is a newer disease today. It's a disease of today, right? So autism, so it's all still under research, but it's a journey. Majority of them come back with great results, or few of them come back with negative impacts. Of course, most of them also stop it by themselves. But if you change the dose, if you give them the right dose, sometimes if you give them CBD with THC, they've always come back with, "No, doctor, this is working better." In fact, I've had a patient who says if they give the morning dose in the night, the child does not sleep at all. Whereas if they give the night dose in the morning, uh, the child sleeps. So the dosage, the timing also changes, because the morning dose would have gotten over. So what they would do is give the night dose in the morning. Then that will also create some changes, right? So if they give the right dosage, right time as prescribed, as we've done the trial and error, and if it continues to work, it will continue to work. So yes, I've also gotten negative effects, but it only means that we need to dwell deeper and find the right dosage, the right concentration, the right chemical compound for them.
So there is no readiness of the body for it. It's more to do with the nuances of the dosage, the timing, and everything, the composition.
Correct.
Right. So yeah, there are questions
Also,
about.
at this point in time, Ruhi, I want to tell you some papers. In fact, one theory says autoimmune conditions or even autism, there is something called endocannabinoid system deficiency, right?
Okay.
So if we are deficient that way, then we do not produce our own endocannabis, which means our homeostasis is still struggling, which is why we land up in those disease states. So cannabis will help in that deficiency. So it's also it works as a supplement there.
Right. Yeah. So again, some questions on how soon can we see the results in children with autism?
I've had patients come back in 4 weeks and say they're seeing good difference. But at least give it 4 weeks time. They will start seeing results in a few days. But for us to say anything concrete, 4 weeks is good enough time.
Okay, I don't know if you want to answer here. Where can we get CBD and THC, and how much quantity should we give to a 4-year-old child diagnosed with mild autism?
For a 4-year-old child, you don't have to give THC at all. You can only give CBD. After this one, you can get back to me. I can send you vendors' numbers. You can contact them directly. There are online platforms that for the links I can send you. You can order from there as well. But like I said, for all online platforms, for all vendor buying, you will need a prescription.
So Mr. Sandeep is asking, how does it help in cancer? Okay, how does it help in cancer? Does it help in relieving pain or pacifying the patients?
Both. And added one is I've had patients, I've had papers, I've had histories. My mentor, Dr. Tahir, who is treating a lot of cancer patients, where your cancer cells are not seen anymore. You can even reverse cancer. It does help with the pain. It does help de-stress the patient. It also helps in destroying the cancer cells. At least the progress of the cancer will be much, much, much slower. That is something that I've seen. I generally did not take cancer patients privately with CBD, but when they only come for CBD prescription, I have seen that their PET scans, reducing the inflammatory effect, the activity in PET scan has reduced just with CBD. So yes, it works in cancer patients at all fronts. De-stressing, pain, sleep, at the cost level, at all fronts.
Yeah, the whole spectrum that it brings, right?
Yes.
Okay, so Mr. Sandeep also wants to know your protocol for autoimmune diseases.
For example, if it's psoriasis, then it's both intake and application. If it's arthritic pain, then it's only intake most times. Applications don't work much in arthritic, or it can be a combination, because if you take both intake as well as application, both of it gets to your bloodstream, right? So it can work double time, but it's basically very, very individual, like how functional medicine, there is no one set protocol for the disease. It's a protocol for the patient.
Right, yeah. So Jayashree is asking Dr. Visalam, she has IBS with diarrhea since last 20 years, and she took CBD for 2 months with good results, but perhaps began to need higher doses, which I could not handle during the daytime. Hence, I had to discontinue. So your advice.
So what you can do.
She was taking 250 milligram capsules.
Okay, so 250 the capsules will work wonders if you have any gut autoimmunity. So what you can do, Jayashree, right?
Yeah.
Yeah, so what you can do, Jayashree, is take only CBD sublingually in the morning. Take CBD and THC in the night sublingually. That will help you manage when you go on higher strength. You always take it in the night, so you'll be able to manage it. Take only CBD during the day, so that you won't have any day symptoms. That's what I do. Capsules, don't take it. Capsules, if depending on what capsules they are, if they're balanced capsules, whether THC, CBD dominant, depending. Take only pure CBD during the day. Take CBD, THC. Don't forget, you need THC for IBS. Take CBD, THC in the night, so that you will be able to. You won't have any effects of THC, so that you will be able to sustain it for a longer period of time. Sustain the good results.
Yeah. Okay, so is Meniere's disease also been treated with CBD?
Meniere's, yes, very much yes. In fact, one of my first few patients privately who I treated with CBD were Meniere's. Yes, it works. CBD and THC works. Yes.
Wonderful. So yeah, does the body get used to it? it doesn't, right? That you explained that.
See, like I told you, it become resistant, right? So which means your body gets used to it. So getting used to it is two ways. One is sensitizing the body, and secondly is it will become resistant. So those are two things of body getting used to it. You sensitize the body. If somebody is very new to it, you sensitize it with something, and then you maybe like your Vijayavati, your Trilokya Vijayavati, which has only very small amount of CBD. You sensitize and then you give them higher dose of CBD and THC. But after you start giving them higher dose of CBD and THC, because it's demand feedback, your body gets resistant. So you give them a break, maybe 3 days to 1 week break, and then you start giving them higher dose, you will overcome the resistance. Yes, body does get used to it in both good and bad, in sensitizing it as well as in becoming resistant to it.
So let's say when we give it to children on the spectrum, right? So you give it for a certain period of time, you see an improvement in them, right? And then when you discontinue giving it to them, right? So does the internal system sustain without it?
For a short period of time, it does sustain without it, not for a longer period of time. Because, like I said, like one theory which I believe in autism, there is a deficiency of endocannabinoid system by itself. So you will have to constantly supplement it. But if you've been giving it for 3 to 4 months and 6 months and 2 days break, 3 days, if you don't take it, children don't have any harmful effect. They don't go back to original. They actually sustain. They actually maintain it.
So primarily the question here from, I guess from the parents is also that if they start giving, CBD to the children now who are young, let's say 4 years, 5 years, 8 years, and then does it have to be given for life?
Not really, because as the child grows, there's a great amount of possibility that your endocannabinoid system will also develop. Right? So it is not a requisite that you don't have to decide today. It's a lifelong thing.
Yeah.
So there are possibilities where you don't require it as well, where you don't need it. But it also depends. No, I mean, when it comes to autism, it's still very gray. At what stage do we say, okay, autism, we can stop the treatment? Like, what are our final goals in autism? Of course, children do not become the so-called normal according to norms. For me, autistic children are also normal. But what is the criteria that we are setting up for them? If they've achieved that, can they stop endocannabinoid? So that is something I don't know.
Sorry about this.
No problem. It's a child. I'm sure the child will know.
Yeah. So also I'll add there, doctor, that, it's again, we need to give the body the right conditions, right? We cannot just depend on CBD alone. There's a whole lot of things that need to be changed: the diet, the lifestyle, so many things. So it's multifactorial. Every disease is multifactorial. So is autism, right? So we'll have to work with every aspect and see, kind of holistically bring out the change in the children.
And CBD is an addition. In fact, recently I attended Dr. Lenny DeCosta's intravenous course, and he says autism children, he puts them on chelation and IV nutrition on a regular basis, and he's seen good results. And of course, like we know, Dr. Ashwani has his own protocol for autism with good results. Likewise, CBD with good results. So you have to, you can bring them all together and give the best treatment the child deserves. And see until what stage you want to keep giving the child the treatment. What is your end goal? Some people will say, at least if the child is not self-harming, I'm okay. If the child can go to school, I'm okay. So the goal is set by the parents, right?
Absolutely. Yeah. So I have a question now. LDN also works on the same pathway, right, in the body. So how, like, do you combine both CBD and LDN together?
Okay. So with cannabis, it is CB1, CB2 receptors. They're endocannabinoid receptors. With LDN, it works on the opioid receptors. They are very, very similar, but different receptors. Which is also why with opioid addiction, with alcohol addiction, CBD works as de-addiction because the receptors are quite similar in anatomy. They compete for it and they win, which is why your de-addiction is very, very successful. With LDN, it's the endorphins, right? That gets blocked, and when you stop the LDN, there's a blow of endorphin. That is what will help. In fact, both CBD, that is endocannabinoid system, and opioid system, they work in synergy. So yes, I do give LDN with CBD. They work in synergy, and I've got great results. Great results. Hashimoto's, alopecia areata, CBD and LDN, they work wonders. Together, they work wonders. Of course, different time ranges you give them. You give them CBD first, and the last one you give them LDN, because LDN can cause some nightmares. Last one, also after LDL, you need to be nil parole. You can't take CBD after that. So I give CBD 1-2 hours before and give them LDL. It works. They work synergistically. It works. In fact, CBD works synergistically with most of your pain medications, with opioids, with your sedatives. They work in synergy with all of them. The only contraindication that I currently practice, or that is currently proven, is your beta blocker, because CBD can bring your BP down, it can bring your heart rate down. So if they're on beta blocker, give them after 2 hours of it, or monitor your BP and heart rate and give them CBD. In fact, after a while, I give them CBD with beta blocker. After giving them CBD for a while, I titrate the beta blocker and I stop. So you can stop the blocker as well. So it works synergistically with most.
Wonderful. What's your view on PEA? Dr. Visalam, your video has stopped. Can you hear me?
I can hear you. I think my internet.
Okay. You are, but it's not clear.
Okay. Okay. I think.
Are you back, Dr. Visalam?
Can you see me? Can you hear me?
I can hear you. Yeah.
Okay. Yes, I'm back. Sorry. Guys, it's raining in Chennai, so internet connection is quite unstable. Sorry for that. Rain in Chennai is something that you don't expect.
Okay. Okay. So, what's your view on PEA? Sparmitol ethanolamide.
Yes. So, Dr. Ruhi, PEA is actually a natural endocannabinoid and which is available commercially. Like I got this Parmiges with the name of Parmiges, it's available.
Okay.
So that's Dr. Visalam. Can you see this? I think it's coming reverse. I don't know whether you're seeing it reverse.
I can see it clearly, Dr. Visalam. You're on mute.
Is it coming reverse?
1 minute. No, it's fine. It's fine, Sandeep. Ritala 354, a blend of PEA, ginseng, and Daidsane. Yeah, I can see it.
It is also working on endocannabinoid system, and and it is being used for multiple sclerosis also. And I was asking you what are the protocols. So I was interested along with LDN. Are you aware of this compound, dimethyl And
actually, I've heard about PEA and genistein, but I've not heard about the Ritala 354.
Well, that's a commercially preparation.
Yeah, but I'm saying I haven't heard about the combination with Daidsane, but yes, I've read papers with PEA and genistein where it does work on neurodegenerative conditions. Yes.
So how does it work with the cannabis oil, CBD oil? Can you find out and just because this is something related, I don't know much about all these things, and also because and suppose it doesn't produce high, it doesn't produce other things, so maybe it can work an alternative or maybe synergistic action. And when I was talking about the protocols, I was just interested when you're using autoimmune, are you combining LDN, CBD, by high dose vitamin D, or you're just doing CBD, or that's what I was.
No. It's always a combination. It's always a combination, right? But the high dose vitamin D, I don't go up to lakhs. I still keep them for 20-30,000 per day, right? Oral vitamin D. The rest I leave it up to the sun exposure. So I don't know how much they're actually making in a day. But LDN and CBD, I give them together. But I do not start them off as soon as they get into the protocol, depending upon how they respond. Like I've had Hashimoto's patient for 3 to 4 months, whose symptoms, everything got better. She's also a patient of alopecia areata. When I started LDN, her antibodies also came down. She started regrowing her hair also with CBD, with LDN, and with all your other protocols, high dose of vitamin D and everything. But they work wonders in combination. They do not have any interactions as such that I've seen so far.
So in autoimmune, do you give CBD in the morning and CBD and THC in the evening?
Depending on the patient. There are patients who can tolerate CBD, THC in the morning also. But you always start, even if it's pure CBD, you always start it in the night only. And then later you make it morning. Then if they still require it, you add it in the morning, afternoon, and night. So you have to make a plan. But you always start with small dose in the night. That's like a set rule.
When did you add THC to the CBD? When do you decide to add THC, especially in autoimmune diseases?
In the beginning itself. THC, I start them in the beginning itself. If it's autoimmune, THC in the beginning itself. But of course, it depends, right? There is 4:1 CBD, where CBD is less. There is 6. So 6, the first one is always CBD. The second part of the ratio is always THC. So for patients, there is 6:1 combination, 4:1 combination, 3:1 combination, 2:1 combination, 1:1 combination, 1:2 combination. But for neurodegenerative patients, I start them on THC dominant right away. But for other autoimmune conditions, I start them on CBD dominant, then slowly make it balanced.
Thank you.
My pleasure.
Yeah. So Jaya, you can ask your question.
Okay, so doctor, the first thing is my child is 4 years old at the moment, and he is having a mild autism. Okay, so we also heard about this CBD oil. So how, is it safe to give to 4 years child? That's the first question. I probably might have missed the initial conversation. You might have addressed such questions, but this is the first question I have at the moment.
No, yes, it's very, very safe to give the child. Okay, please understand, please know that CBD is a plant-based herb. It's a herb. It's herbal oil. So yes, it's safe. It all your heavy metal, because it's plant. It has all the benefits of all other plants, and because it's ethanol extraction or carbon dioxide extraction, even if the plant has any heavy metals from the soil, it's all taken away. So it is very, very safe.
Okay, so Visalam, is it also helping understanding the conversation, or it will help improve their understanding conditions or capabilities?
As a feedback, I've heard it. Yes, there are parents who come back and say, "Doctor, he's listening to me more. He volunteers to do certain things more." As a feedback, I've heard all of those. But have I heard it from all of them? Honestly, the answer is no. But parents who've come back and said, "No, doctor, he's listening to me more. He has better control now. He at least listens to me, whether he does it or not. He at least listens to me. He's trying to make conversations. Only if he understands, he'll try to make a conversation, right? So he's trying to make a conversation." These are all feedback that I've gotten. Yes.
Okay. Does it also increases the hyperactivity in the child? Because my child is still mild, but
it reduces the hyperactivity. It reduces the hyperactivity. It calms the child down.
Okay. And what are the side effects for this particular product, or we do not have
when you give only CBD for a child, the child do not get high at all. So those are the only side effects that are for CBD that we've studied as theory, that we've studied in experience as well. So for a child, I'm doubting if there are any side effects. But one thing that you need to understand, Sandeep, is the first CBD that you try, if it does not work, don't give up on it. Try different concentrations, different dosages, and find the right dose for your child. That will help the child.
Okay, so
keep up it.
Sorry?
So keep up to it. Like
Yeah, sure.
don't give it
So
up. Don't give up immediately.
yeah, that's the whole idea. So one last question: from where we can get that prescription and the dose quantity so that we
Prescription you
can
can,
go for it?
in the prescription that you get, you will have dose and quantity. Of course, there's my mentor who also gives you. There are stores which gives you, all the CBD stores today, whether it be Bohico, whether it be Magican, whether it be CBD store, they have their own panel of doctors. I'm also panel in I'm also one of the doctors in most panels. You can come to me directly also.
No, see, Visalam, we are not we're not based out of India. So I also have a question that is it easily available in any pharmacy or any in any other country, or do I need to
Where
get
are you from, Sandeep?
UAE?
In UAE, you do not get it anywhere. In UAE, it's still not available online. One thing that you can do is you can buy it in India and take it to UAE. I've had patients who take it to UAE who was not stopped in the check-in or anything. It's a small oil bottle.
That's fine,
You
but
can put it in your
every
check-in
time when you
baggage and take
bring
it.
any of the medicine from India to Dubai, you need to have a prescription ready with you. There
Of
might be
course.
chances you get through, but there are chances where you get stuck and they might ask you for the prescription to be ready in your hand. So
Of
I
course,
need
you
to
need
have the prescription.
you need prescription in India itself. Forget in Dubai.
Okay.
You need prescription in India itself. So all your CBDs are only sent to you if you have a valid prescription.
Okay.
So
So I can get it
you
from.
missed the session. That's why, so it's a prescribed drug, and so you'll need to have a prescription. You cannot just buy it off the shelf,
Okay.
and
You
only
can buy the balms. You can buy hemp infused CBD infused balms of the internet, of the online platforms. But for intake, it needs to be prescribed.
Okay. So I should get in touch with Dr. Ruhi for that.
I have
Correct.
shared doctor's website in the chat. You can connect
It
with
has
Dr.
my contact. It
our
has my
website.
contact details, and you can contact me, Sandeep.
Yeah. So, Dr. Visalam, now for any practitioner who wants to use CBD, right, for the patients, so they need to be licensed to practice medical cannabis, right?
The requirement is still gray in our country,
Okay.
right? As long as your doctors, you are licensed in any of the boards, Ayurveda, homeopathy, allopathy, you can still prescribe. You can prescribe it until the rules are clear. It's still very, very gray because it's very new to the country. It's still very gray. Who can prescribe, who cannot prescribe. Only thing that we are sure is it has to be a prescribed drug from a doctor, from a licensed doctor.
So you got yourself trained in this, right? How to use it.
Correct. When I started, when I went to institutional functional medicine, when I went to the US, Dr. Terry was big on CBD. So there I learned some. Of course, we got the functional medicine certification, but at that point in time, I was not able to source CBD. So I had to bring it from US, or I had to bring it from South Africa, where it was legal, to give it to my patients personally. Then it became very legal. Then I became part of those aggregator platforms or those manufacturing platforms. Then I started. Of course, my first training was from institutional functional medicine, how the science works and how it will work and how it's not to be stigmatized. Then the second part of learning happened from Dr. Tahir. He's one of the first and one of the prominent CBD prescription practitioner in India. So he's also my mentor currently. Of course, then I did a course from Society of Cannabis Clinicians, which is an international society. So that's where I did my course from.
So wonderful. If any practitioner wants to get themselves trained, they can go ahead and get these.
Of course, there are many institutions today. There are many institutions today.
Or if they do not want to go ahead for any, further training in this, then they can, probably reach out to you for, for the right dosing, and you can prescribe it for their clients.
Correct. That is correct.
Wonderful. So I think I've covered all the questions in the chat box. Yes. Yeah. So thank you, Dr. Visalam. This was amazing. This was really informative. I'm excited about using CBD, and I'll just see how to get started there. But definitely it's an amazing tool, and thank you for sharing your knowledge on this with all of us. And anybody who wants to get in touch with Dr. Visalam, I have shared her website in the chat box. You can please connect with her.
Yes, thank you. Thank you so much, Ruhi. Thank you so much, Indian Association of Functional Medicine, for being so open to all our different modalities to treat. It only goes to prove that us functional medicine practitioners, at the end, we want the patient to get better. Whatever modalities we use, at the end, we want them to get better. So this webinar is another example of that, where we are all open to learn new things and treat and help our patients. So thank you so much for this opportunity, and thank you so much for being so open for newer ideas and newer modes of treatment. Thank you so very much.
Thank you. Thank you so much. And thank you all the people who are part of this webinar. And we will be coming with our next member in the next month, end of the next month. And I hope you all stay excited about it. Thank you so much. Thank you.
Thank you. Thank you. Thank you all so much.